I want to die. Help me die. If a patient says that to a doctor, should doctors be allowed to assist a patient if they say that I want to die now? I had enough of for whatever reason, for pain or for terminal illness. What is the authenticity of this power? The favorable people, they will say that it's an autonomous decision. It's a decision that is based on different conditions or situations, and that should be legalized. But there is another part. The critics will say, or I'm not sure if it should be ethical part or critical part. The critics on this topic will say that, okay, that can be a dangerous line once doctors are allowed to do that practice. Once someone says that, okay, I am allowed to help people die, what is the moral line that we're going to cross? Because again, animals, we are all animals. We are not basically humans. We have a cover on top of us. So that can be a very crucial and a dangerous line that can be crossed once doctors are allowed to have life in their hand. They already have the lives in their hand, but once legalized, that can be a very dangerous line. So assisted dying, is it helping people to get rid of the trauma or the suffering, or is it depressing other people or forcing people to choose death over life? There are people who will say that, okay, it is removing a suffering, it is getting them rid of their sufferings, their pain, unnecessary pain and sufferings. But on the other side, the humans have a phase of depression all the time, and we all been through that. Even anyone who says that I've never been depressed, that's a lie. Or that's not a normal human being that is saying that, because these feelings, they make us human only, or the creature we are. These are the natural part of our capacity, innate capacity or capabilities or our properties. Once someone is depressed, most of the time people choose death over life. They start seeing life as a burden just because of that certain phase of depression. So, if we legalize that, is it not that we are pushing them to choose death? And a lot of people naively will choose that part of death over a very beautiful life that is way ahead of them. If that depression phase is gone, they could have been way bigger person in the society. But what are the repercussions? Is it a positive thing, or is it a thing where we are forcing youth to commit kind of a suicide by legalizing it? The assisted dying care, that should be focused towards, or should we just say that, okay, some of the pain that cannot be cured or recovered just because our current science material or our current medical facilities cannot cure them? A lot of pain at the older age can be cured or can be controlled with certain medications and support and care. But a lot of people who are in support of assisted dying, they say that some pain, some level of pains or sufferings cannot be controlled, but you never know that. You never had a penicillin even, you never had a paracetamol even, or ibuprofen even. How do you know that in very coming near future, when we are coming towards anti-aging medicines and technology, we cannot cure some sufferings even at the old age, some pain? Why we are pushing humans or living beings towards intentional death trap? That's a trap that we are giving them option. So don't think it as it's for older people. It's affecting the whole generation, because then we already know as a young person that whenever things go to a bad phase, we have an option of a kind of a suicidal decision. Why we are pushing the whole generational part towards that side of life or death trap? So, this assisted dying, is it helping a small number of people who run away from life suffering, or they're right on their side? They want to get rid of that innate suffering, and we should not be judging them because we cannot feel their pain. We're not the one going through that suffering or pain. But is it helping only, or is it going to be helping only small number of people, or actually it is taking a whole societal mindset towards a different shift? Because even previously I said that you are creating a mindset from the very beginning. If you cannot succeed in life, then you have the option of dying on your own will whenever you want. You are creating a suicidal society from the beginning, because you are teaching them this is the option you always have. And this can be another step. For example, right now you are saying, okay, or old people should be legalized to have this kind of procedure. But what after 50 years, 100 years? You are pushing that part already towards that direction where you will be legalizing in future that okay, young people have the right to do that as well. Think for the long term. Once we are gone from this era, that will be normalized. Few years back, a lot of things were not normalized. Now we are setting a pathway where we are telling our young generation, okay, it is okay to think that you can die or you can kill yourself or you can ask help to kill yourself. You are asking help from others. Okay, I want to die. Where it's a no in every part of the world, or it should be, we should not have to decide that okay, I have to take my life. You cannot do that. That's not moral in any sense of life. So how do you decide that a person is making a decision based on any external factors or because of the other person even, or the implication of his poverty or pain that he's going through right now, or any other incapacity or incompatibility he just faced, and that his is not his fault. These are external factors that are shaping his decisions. How do we know that? There is no calculated formula that can be decided. You cannot judge that by certain questionnaire or forms or just asking few questions from someone. You cannot do that. You don't know that what's going on inside a person. That is why there is a whole industry inside this UK that is going towards the cure of mental health or depression. Why do we have that part then? Because these people cannot be heard from within. And when you cannot be heard from within, you are not the one to make decision in a right state of mind. And when you are not making the right decision in your state of mind, how can you make a decision of your life? You cannot be expected to make a decision, especially when you're saying I want to die. That means this is the main point where doctors and the society need to stand with that particular person, that no, you don't have to die. You will be out of that mindset or pain. You will be coming out of that, because we have to take care of each other. We don't have to push them or push each other towards the death trap of this assisted dying.